I wanted to chat to Josh today from Notre Dame Medical School about his experience in a GP placement. He joined us here recently on a rotation in general practice at the Garden Family Medical Clinic, and I thought it'd be really good to hear about his experience and what would be important for future medical students. Thanks, Josh, for coming today. Josh, what's your experience in general practice, and what did you find was useful and helpful in your rotation here?
I think this practice in particular can offer a large variety of different patients. You rotate through a number of different GPs, and every GP here has their own particular sort of demographic of patients that they like to see, and that patients are kind of drawn to them. So one day you'll be seeing lots of children with psychiatric things, one day you'll be seeing lots of women with complex pelvic pain. That's seen a lot here, and then you can see sort of anywhere in between. So I think you can see a lot here, and it genuinely is very useful to see that large variety of things.
And if you were to have any suggestions for medical students as they embark on GP placements, what would be some useful tips?
I think get involved, be keen. The team here love it when they see someone that's genuinely keen. You get more out of it yourself, but the GP is, if they know that you're keen and you're showing an interest, then you'll be offered to do more, your experience will be better all around. You can go and see patients if you get involved, put your hand up to do stuff. If you think maybe it's a bit out of your sort of reach as a medical student, just ask, and the worst that can happen is it might not happen, but anything can happen really. So I think just put your hand up and be keen.
Yeah, and as GPs, we get really busy in the day, so if you feel like you've just been forgotten or missing out, speak out and get involved. We'd love to have that assistance. And what I found from our end is it actually makes our job easier having you involved and taking a history before we see the patient, or helping us with day-to-day things that we do in the clinic, checking patients over and presenting them back to us. The more practice you get in this placement, the more useful and beneficial it'll be to you.
Yeah,
so
I agree.
Don't be afraid to speak up and knock on the doors of the GPs and find out about what's interesting day to day here.
Yeah, I agree.
And what do you find in terms of general practice? What are the best parts of general practice, and that's going to help us to promote this for future medical students?
You learn the most. You're seeing everything. Some placements can be very specialised, and you'll only see a very particular sort of demographic or type of patient, but in GP you see absolutely everything. You don't know what the next thing is that's going to come through the door. There's always you can just reflect on the day, and if you think about what have I seen today, the answer is always, well, I've seen everything. The GPs are really good they teach you as they're going along in between the consults or even during a consult, and you learn a lot from the patient. So I think from a medical student point of view, and even as a future GP, I think it's great because there's just so much you can do, especially lots of complex pelvic pain stuff here, lots of psychiatric stuff, lots of peds stuff. The opportunities are endless, really.
So the variety of medicine is really good, and
yeah.
For me, it's the connection with the patient as well, and the longevity of looking after them and following them up really closely over time. So I think that's a really big part of why GP is so important and such a unique field. So thanks for joining us today, Josh, and being part of this video. And also for any future students, we'd love to have you here and join us in our team and the day-to-day runnings of our practice.